Good morning, everyone, and happy Sunday. So today we're going to have another two-part segment. We'll have half today and the rest of it next Sunday. And this is a topic that was requested. And so I'll split it up a little bit so it doesn't become too much for you to understand. So the topic today is on hormone imbalance, as my screen loads. So what are hormones? Let's start with that first, because that's important for you to know what that is, okay? So hormones are chemicals that coordinate different functions in your body by carrying messages through your blood to your organs, skin, muscles, and other tissues. These signals tell your body what to do and when to actually do it. Hormones are essential for life and your health. Scientists have identified over 50 hormones in the human body so far. Hormones control many different bodily processes, including metabolism, homeostasis, which is constant internal balancing, growth and development, sexual function, reproduction, sleep-wake cycle, and mood. So now, what is hormonal imbalance? A hormonal imbalance happens when you have too much or too little of one or more hormones. It is a broad term that can represent many different hormone-related conditions. Some hormonal imbalances can be temporary, while others are chronic, which means it is long-term. In addition, some hormonal imbalances require treatment so you can stay physically healthy, while others may not impact your health, but can negatively affect your quality of life. So what causes hormonal imbalances? Throughout your life and even throughout the day, your hormone levels naturally rise and fall. Certain periods of life causes more dramatic changes and fluctuations in hormones, including puberty, pregnancy, menopause. However, there are several other reasons why your hormone levels may be irregular at unexpected times. Some of the most common causes of fluctuating or imbalanced hormone levels include stress, which everybody go through stress, but it's a matter of how you handle stress. Certain medications, steroid use, just to name a few. These hormonal imbalances are more likely to be temporary or fixable with a change in medication or properly managing stress. Chronic hormone-related conditions can have several different possible causes. In general, the main conditions or situations that cause medically significant hormone imbalances include tumors, adenomas, or other growths, damage or injury to an endocrine gland, or autoimmune conditions. So what are the signs and symptoms of hormonal imbalance? Slow heartbeat, which is called bradycardia, or rapid heartbeat, which is called tachycardia. Unexplained weight gain or weight loss, fatigue, constipation, diarrhea, or more frequent bowel movements. Now, keep in mind, some of these symptoms can also be related to other medical conditions. So you want to make sure that you follow up with a physician and get the proper diagnosis, okay? Numbness and tingling in your hands, higher than normal blood cholesterol levels, depression or anxiety, being unable to tolerate cold temperatures or warm temperatures, dry, coarse skin and hair. Now let's go back to the being unable to tolerate cold temperatures or warm temperatures. That doesn't mean that when you come from the islands and come to Jamaica and you feel a little chill, that may not be it, okay? So let's not mix that up. But really unable to tolerate cold temperatures despite how much warmth that you're getting, you're not able to still tolerate it, or your hands may be cold or change color during that time, okay? So thin, warm, and moist skin, irregular body fat distribution, darkened skin in your armpit or the back and sides of your neck, skin tags, small skin growths, or extreme thirst and frequent urination. Symptoms for people assigned female at birth can be like acne on the face, chest, and or upper back, hair loss, heavy periods, hirsutism, which is excess body hair, hot flashes, infertility, irregular periods, loss of interest in sex, vaginal atrophy, and vaginal dryness. So, do males have hormone imbalance, Brother Rob? Yes, they do. So while our hormones can become unbalanced as we age, many other things can impact hormone imbalance in men. Diet, consistently experiencing stress, living a sedentary lifestyle, genetic predisposition, and even some environmental factors can often impact hormonal imbalance. So what are the symptoms that the person that is assigned a male or born a male? So people assigned male at birth can have an imbalance in testosterone, which is the testes produce, and or other sex hormones, which can cause the following symptoms: decrease or loss in body hair, erectile dysfunction, gynecomastia, which is enlarged breast tissues, infertility, loss of interest in sex, loss of muscle mass, a loss of libido, and most commonly reported symptoms of hormonal imbalance in men. Trouble thinking clearly, often called brain fog, is another common symptom in men. Irritability, mood swings are also frequently cited by these patients. Chronic exhaustion, low mood, anxiousness, mood swings may also be experienced by men with hormone imbalance. Next Sunday, we're going to continue with this topic, and we're going to talk about what kind of doctor treat hormone imbalance. You just go to any doctor, or just your medical doctor? What treatments are available for hormone imbalance? How is hormone imbalance tested? And how do people live with hormone imbalance? I hope this was short, sweet, and helpful. Next week, I'll continue this topic, and you can ask me as many questions as you'd like on this topic once I've completed it. However, should you have any medical questions for yourselves or your loved one, please join us in the Zoom room immediately after service, and I'll be happy to answer those questions for you. Thank you so much. God bless, and enjoy the rest of the service.